My name is Megan Murphy, and today I'm going to be comparing the two healthcare systems between the United States and Hong Kong. To start off with, the United States healthcare system is unique among advanced industrialized countries. The United States does not have a uniform health system, has no universal healthcare coverage, and only recently enacted legislation mandating healthcare coverage for almost everyone. The United healthcare system can be best described as a hybrid system. There are, however, federally funded programs and private insurance. Some of these include Medicare, Medicaid, the United States Department of Veteran Affairs, and employer insurance. The healthcare system in Hong Kong is divided into two sectors, a public one, which is government-sponsored, and a private one, which is more expensive but definitely has its advantages. In Hong Kong, there are 12 private hospitals and more than 50 public ones. However, because they are a lot less expensive than the private sectors, public hospitals and doctors are very popular, which often results in longer wait times. In regards to infant mortality, in 2018 in the United States, there were 590 infant deaths per 100,000 live births. This happens most often in non-Hispanic Blacks. The biggest reasons for infant mortality in the United States include birth defects, preterm or low birth rates, sudden infant death syndrome, pregnancy complications, and injuries such as suffocation. In Hong Kong, however, the infant mortality rate is much lower. In 2018, there were 140 infant deaths per 100,000 live births. Hong Kong is ranked in the top 5 countries with the lowest infant mortality rate. Talking about total healthcare spending per capita, in 2017, the total healthcare spending came out to be $3.5 trillion in the United States. This means that approximately $11,000 were spent per capita. This healthcare spending accounted for 17.9% of the gross domestic product. On the other hand, in Hong Kong in 2017, a total of approximately $157,000 were spent on healthcare, resulting in about $21,000 spent per capita. This spending accounted for 6.2% of the gross domestic product. Talking about the emergency department visits, the emergency department provides services to all who seek emergency care, regardless of their ability to pay, and the emergency department has become an important source of admissions for hospitals in the United States. In the US in 2015, adults ages 65 years and older, there were approximately 57,000 emergency department visits per 100,000. In the age range 18 and under, there were almost 39,000 emergency department visits per 100,000. In Hong Kong, there were approximately 27,000 emergency department visits per 100,000. However, 61% of these visits were non-urgent. As overall health is improving in Hong Kong, the emergency department visits have declined 4.4% since 2017. Next, with talking about tobacco control efforts, in 2016 in the United States, 37.8 million US adults were current cigarette smokers, 17.5% being men. In an effort to control tobacco usage, at least 2,082 United States college and university campuses had smoke-free or tobacco-free policies implemented in 2017. Additionally, 8 states prohibited indoor e-cigarette use and combustible cigarette smoking in work sites, restaurants, and bars. Furthermore, 14 out of the 18 airports are smoke-free, and tax stamps are required on cigarettes by 48 states. In Hong Kong in 2015, about 10% of the population smoked, 84% of these being male. Smoking is banned in all indoor areas of workplaces and public places, including restaurants and bars, open areas of schools, leisure facilities, bathing beaches, and public transportation facilities. Those who smoke or carry a lighted cigarette, cigar, or pipe in no smoking areas or on public transportation are liable to a fixed penalty under the Fixed Penalty Smoking Offenses Ordinance. When talking about safe drinking water, as of 2017 in the United States, for 85% of the population, tap water is safe to drink. Only about 15% of people are affected by health-based contamination regarding things such as trihalomethanes and copper, making the water dangerous to drink in their homes. However, the most at-risk populations for contamination are in small rural areas. In Hong Kong, there are 21 water treatment works coming from the Diaojiang River, which produces 80% of the fresh water it uses. The average chloroform levels in water remained at less than 50 micrograms per liter. The Water Supplies Department has developed an integrated drinking water quality management system to monitor water quality from sources to taps to ensure that the drinking water quality complies with the Hong Kong drinking water standards. Next, when talking about unmet needs for mental health, in the United States in 2018, there were 13.4 suicides per 100,000. 56.5% of adults with mental illness receive no treatment, and for those seeking treatment, 20.3% continue to report unmet needs. A lack of insurance or inadequate insurance, available treatment and providers, and insufficient finances are a few of the contributing factors to these unmet needs. In Hong Kong in 2017, there were 11.5 suicides per 100,000 and 853 suicides total. Here in Hong Kong, suicide pacts are common, where citizens collectively join groups that wish to end their life and they carry out the act together. Many citizens in Hong Kong believe that psychiatry students need to be better educated to provide more adequate care to their treatment for patients with mental illnesses. Areas of improvement regarding mental health include the negative stigma, quality of care, and access to mental health services. When talking about teen birth rates per 100,000, in the 2016, the United States, there were about 2,000 teen births per 100,000. This rate has declined 51% since 2007 with increased education. Additionally, there were 110 abortions per every 1,000 teen pregnancy in 2017. The teen birth rates in Hong Kong are much lower. In 2017, there were 1,000 teen births per 100,000. This country has the lowest teen birth rate from the age range 15 to 19 years of age. 51% of teen pregnancies end in abortions. Finally, some key takeaways from this presentation are just that the United States healthcare system is a mixed hybrid system with federally funded programs and private insurance systems. The United States demonstrates a higher rate of infant mortality and spends more on healthcare than Hong Kong. Majority of the United States has safe drinking water, as well as Hong Kong, and recent data shows that approximately 13.4 suicides happen per 100,000, suggesting that there is room for improvement regarding mental health. Lastly, there is higher teen birth rate in the United States that can be declined by further education. The Hong Kong healthcare system, on the other hand, is made up of public and private sectors varying in costs of care. Hong Kong has a much lower infant mortality rate than the United States, ranking in the top 5 lowest in the world. They spend much less money on healthcare than the United States and ultimately have better health outcomes. They too have safe drinking water and exhibit lower rates of suicide and teen births. I hope you enjoyed learning about Hong Kong's healthcare system compared to the United States. Thank you.